Hi, it's Twila again from Citizens Council for Health Freedom, and I have with me Dr. Mark Lopatin, and I met him at the National Physicians Coalition for Healthcare Policy, and he had an interesting statement yesterday as well as some interesting comments at a dinner that we were at last night, and I thought it would be great for you all to hear what he has to say about third-party payment and payers versus patients paying their doctors. And so why don't you go ahead, Mark, and let them know what your thoughts are on this issue.
Sure.
Again, he's an MD, a medical doctor.
Sure, I'm a rheumatologist practicing outside Philadelphia, Pennsylvania. One of the problems we see in healthcare, unlike any other field, is that the consumer of healthcare services is different than the purchaser of healthcare services. When you go to buy a car, you decide if you want a very expensive car and you're willing to pay more for it, or a very inexpensive car because you want to save money. That doesn't happen in healthcare. The consumer of healthcare is the patient. The purchaser of healthcare is the insurer. And both of them have different agendas in terms of trying to provide care. So what we need to have happen is the consumer and the purchaser need to be the same individual so they can decide whether the cost of something is worth it. On top of that, there is no transparency in terms of cost. So patients have no idea what things cost, and since they're not paying for it or paying a portion of it, understandably they want as much as they can get. The insurer, since they are paying for it, wants to limit the cost. The example I use for this is if you go into a restaurant and see something that's listed as market price, do you ever order it without knowing what the cost is? In medicine, this happens all the time. So if we had a situation where patients paid the doctor directly and the insurance company reimbursed the patient, now the patient is vested in the cost. They need to know that something is $1,000 or $5,000 that they have to shell out of pocket, even if they're going to get reimbursed for it. It's going to make them much more savvy in terms of shopping around for cost, shopping around for quality. You know, is an MRI in one place better than in another place? Is one MRI worth $1,000 that much more valuable than one that's worth that costs $100? So by putting the patient at the center of this, patient-centered care, instead of the insurer, we get better value, less expense, and better medicine as a whole.
So, Dr. Lopatin, what is your preferred type of insurance? If you were king, what could you do? What would you do?
Well, if I were king, insurance would be strictly for catastrophic coverage. I mean, insurance is designed to insure against disastrous consequences. That's what we have with auto insurance. Auto insurance does not cover gas, it does not cover oil changes, it covers car accidents and more severe things. In healthcare, the public has become entitled to think that all medical care should be paid for by somebody else. A lot of that comes through doctors, hospitals, the media, and so forth, but the message has gone out that someone else should pay for health care, and this is unfortunately what I've seen. So, in answer to the question, the idea would be that routine things, doctor's visits, labs, and so forth, would be paid for by the patient. One caveat to that, however, the cost needs to come down in order for that to be viable. If patients are allowed to shop around for cost, and doctor, presumably an open market system would enable that. But at the cost that currently exist in healthcare for poorer patients, this is a no-go because there's no way they can afford it. So the system needs to change to allow that to happen.
So thank you, Dr. Lopatin, and I want to thank everybody for tuning in and being part of this Facebook Live, and there will be more to come. Thanks so much.
Thank you.